So continuing around the ankle and foot complex, we're going to point out a few more kind of contractile and non-contractile structures or tissues. So the first one I want to point out is going to be the peroneus longus. And so this would be one of the primary movers for foot eversion or subtalar eversion. And so that's going to be bringing the outside of that foot outward or laterally, okay? And so to appreciate kind of the belly or muscle, we're going to find that fibular head, okay? And as he goes from neutral and everts, you're going to see that muscle belly really kind of pop up there. And we appreciate that as we get down and distal into the fibula, the tendon is going to be most palpable here just superior of the lateral malleolus. We do know that the tendon runs just posteriorly to the lateral malleolus and does insert into the first met, but the most palpable region is going to be just there around the lateral malleolus. From there, we are going to go into some inversion and talk about the calcaneofibular ligament, okay? And one of the lateral ligaments around the ankle. And so we have the ATFL, which is going to be just medial and slightly distal than the lateral malleolus. And you can kind of palpate that. That's one of the most common sprained ligaments of the lateral ankle complex. In the backside of the malleolus, lateral malleolus, we're going to have the posterior talofibular ligament. And then really as we bring into inversion, just distal or just inferior, as we go into inversion, you can really appreciate the ligaments of the calcaneofibular ligament there as well. Matt, I'm going to have you slide your leg on the outside of the table. And we're going to just look at a few or one more kind of medial structure, which is going to be our tibialis posterior. And so for this one, what we're going to do is we're going to stick with inversion here, okay? And we know that the posterior tib is going to insert just kind of just posterior to the medial malleolus. And so as we come into inversion, this is one of the more obvious tendons wrapping around the medial malleolus. And so go ahead and relax your ankle good. We'll come into some eversion and then again contract, go ahead into inversion. And again, you have the tibialis posterior tendon going just kind of towards the posterior aspect of the medial malleolus.